Do you know that if you have a chronic disease, you can actually get your infusion at home? Stick around. We're going to talk about it in the next episode of Senior Care Made Simple.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, good evening, everybody. Thank you again for joining us one more time for the Senior Care Made Simple podcast. We are here every day to share with the listeners about different things in our world, mostly about healthcare, planning long-term care, and also a lot of resources and information that a lot of people don't know about. So I want to introduce my co-host is Doris Muscarella. Good morning, good afternoon. Good evening, Doris.
Hello there. It's nice and cool in Florida.
Oh, that's for sure. Really enjoying it today. How you been?
Wonderful. Glad to be here.
So today we have a very, very different, incredible guest today. We have Howard Singer. He's the owner and CEO of Vital Care Infusion Services. And we also have an amazing, incredible pharmacist, Joshua. And there's so much that they can do for chronic diseases at home that a lot of people don't know. And we are very, very happy to have Joshua and Howard here. So good morning, good afternoon, good evening, gentlemen.
Hello. Thank you for having us. It's an honor to be here. And I think we're very like-minded in what we try to do for patients and bring world-class care to a convenient setting for them. And frankly, your reputation in the market, it's aspirational for what we're trying to build. So it's an honor to be here.
Thank you so much.
I am ready to learn more about the specialty infusion pharmacy. That's new to me. Howard, can you give us some background as to how you got into this and a little background about the specialty infusion pharmacy?
Sure. So I come from the world of business. I'm a graduate of Wharton and Harvard Business School, but come from a clinical family. My dad is a physician here in South Florida. I'm the nephew of a pharmacist. So I grew up in and around healthcare, but spent a career in investing for over 15 years and felt it was time to, change things up and start working on something that actually can impact people's lives in a really positive way. And home infusion is a fascinating space. It's, there's incredible need for these therapies, but to get it done in the comfort and convenience of your own home versus having to go to a hospital or having to go to a clinic or a doctor's office. Sometimes these therapies are monthly for the rest of someone's life. And for them to try to maintain some sense of normalcy in their life and be able to sit on their couch and watch TV while they get an infusion, or we have some patients that work from home and they are working at their computer while they're getting an infusion with one of our nurses overseeing all of it. So it's about providing world-class care and these phenomenal therapies that improve the quality of people's lives, but doing it in a way that doesn't interfere with their lives.
And everybody's now working remote, by the way, so
Yes.
It's great to have this service. Dr. Joshua Vinson, did I pronounce that correctly?
Yes, you did.
Can you give us some background of your expertise, please?
Sure. So I've been a pharmacist a little over 16 years. Started my pharmacy career in what most people would know as retail pharmacy. So that's going to be your Walgreens, your local CVS. Did that for a little bit and was able to transition into this whole new world of infusion pharmacy. And I'd like to define what we mean by infusion pharmacy because a lot of people, listeners, may not even know what it is. So when you go to your pharmacy, your Walgreens, your CVS, they're most likely going to dispense some type of pill or a cream, something that you can ingest or apply. But infusion pharmacy, we primarily going to be dispensing medications that need to be infused in the vein. So still two ways of dispensing medications, but completely different mechanisms of actions and disease states. So I've spent the majority of my career, at least 10 years in the infusion space, working with some of the nation's leading companies. So it was Providence that led me and Howard together. And I, aside from the clinical aspects, the entrepreneurial aspects of opening up businesses and starting things from the ground up really appeals to me. So we were kind of a good fit from both facets.
So what is home infusion?
So home infusion pharmacy is essentially as a patient, if you have a particular disease state, and I'm going to kind of separate all diseases into two categories, one being kind of post-acute and one being chronic. Post-acute is basically going to be those things that are require a very short sprint of medications. So if you have an infection and you need antibiotics for 3 to 6 weeks, that would be known as like a post-acute treatment. Chronic treatment is going to be something like, as Howard mentioned, you may have to be on for the rest of your life, right? So you think about people with autoimmune diseases. You think about people with immunodeficiencies. You think about people with enzyme disorders where they're not able to do things that most other people are able to in terms of just normal biologic processes, right? So home infusion can treat both of those. Where Vital Care of West Palm Beach tries to shine is to focus more on the specialty aspect of things. So we're treating patients who have a lot of inflammatory autoimmune conditions, such as Crohn's disease, ulcerative colitis, people that have immunodeficient type diseases as well, which we would use products that would basically supplement their immune system. So that's kind of the 30,000-foot view of what home infusion is, or what infusion is rather. The home part kind of comes into play where you have site of care considerations. So if you were admitted to the hospital and it was determined that you needed an infused medication, right, because that would be better treatment for you than taking a pill orally, then you really have two options, right? You could stay in the hospital and get that infusion. We talked about on the acute side, it could be 3 to 6 weeks, or on the specialty side, if it's something you're doing every month, you could get that done kind of in a hospital, in an outpatient infusion center, or for both treatment types, you could get it done in the home. And as you mentioned, Doris, people prefer to be in the home. In this remote post-COVID climate that we're in, the home is kind of the center of which a lot of people, are doing most things. So we have the ability to prepare all medications that can be infused and deliver them to a home. And then what would happen is a licensed and qualified nurse would show up and infuse the actual medications.
And we have a lot of patients that are home.
You can get it done anywhere in a hotel. If you are in a hotel and you don't feel good and, you're traveling, let's say you're traveling, and who's going to infuse you? It's an option that you have. And there are those remember you guys, we are in Palm Beach, Florida, but there are pharmacies like this all over the country. You just got to get yourself informed.
Certainly, if you're homebound, this is the right option for you. But you don't need to technically be homebound for this to be a great option for a patient. We were at the Crohn's and Colitis Walk in West Palm Beach a month or so ago, and the number of patients we met who had no idea they've been, going to either a doctor's office or an outpatient center for years and never heard of the fact that they qualified for home infusion and that they could get it at the home. And it doesn't, sometimes a patient can feel a little bit lethargic after an infusion. So you could be a totally capable, mobile person, but you feel tired after infusion. So now you have to think about who's going to drive me home. The 40-minute drive that I just did to the hospital or to the outpatient center. Do I have to get an Uber? You don't have to think about any of that stuff. We come to you, we bring the nurses there, all the equipment that you would get at the hospital or at an outpatient center, we're bringing to the patients' homes. But you're right, awareness of this as a sort of as a modality is so low. So that's what we're trying to do, is trying to just share that patients can speak up for themselves and say, even just asking their physician, can I get this done at home? Because a lot of physicians sometimes have it in their own offices, or they have, their ways of doing things over the years, and they may not even be that accustomed to this as a channel for it.
I have a question, because every time I hear infusion, I feel of cancer, of cancer treatment. How does that relate to what you do?
That word infusion can cover it's a broad brush, broad stroke, right? Chemo, you think, someone going to a wellness clinic and getting an infusion of B vitamins, right? There's all types of infusions out there. But we differ a little bit in that we're treating chronic disease states. So, certainly, people that have cancer are getting treated via chemotherapy and oncology, but that's just not kind of where we focus, because with a lot of the chemo infusions, there's a lot of monitoring. You do need to be in one of those spaces where there's a little bit more support clinically if there was kind of a reaction, right? Chemotherapy is essentially infusing someone with a little bit of drug that is wearing away the immune system, so a whole host of side effects can happen. We are providing medications that aren't as adverse to the normal biology of a particular patient. So not necessarily chemo, but our infusion suites are perfect sites of care for people who have Crohn's or ulcerative colitis. And all of these medications are perfectly safe to administer in the home as well.
And we do have patients that come, their prior experience is actually going to these same clinics that do offer chemo, that end up being, very large rooms with lots of chairs, which certainly serves a purpose. We also wanted to make our infusion suites for patients who do prefer not to have it done at home. They can come into our suites or are more comfortable coming into a suite. But we wanted that to be a little bit more spa-like and comfortable and more private than a typical chemo infusion center. So we think that also we're trying to provide a concierge-like service, a white glove service that feels, again, for patients that have to do this every month for the rest of their lives, let this be, it should be a highlight of their week. They're seeing the same nurse they see every month. They build a relationship there. They're coming to a really comfortable setting with TV and great snacks. Like, let us try to make this as good as it can be, given it is a burden that these patients deal with. So that's another way we try to differentiate ourselves, is just by making it as pleasant of an experience as possible.
I have another question.
Of course you do. Yeah. Of course you do, Doris. Doris always have a lot of questions.
Curious,
which
I like it.
Absolutely love it.
It's great.
Okay, so the B12, you had me at B12 because I've heard that B12 is one of the best shots, infusions and all that stuff.
I guess I opened the can of worms, right?
Yeah, you opened a can of worms because we mature people sometimes go to this place to get infusions with B12 and all that stuff. But if you provide the service, or if we go through you, can we do that? And how do we get a hold of you? And what's the process?
Yeah, so typically we're going to focus on medications that come with a prescription and that, are, FDA approved to treat certain conditions, right? I think the med spas and the wellness sector, they kind of have a pretty good grasp on, the glutathione infusions, all your vitamins, so on and so forth. Perhaps that'll be something we offer in the future. But when we're looking at insurance and what insurance will pay for, we have to stick kind of with FDA approved indications and FDA approved treatments.
So when I met Joshua and Howard, I actually went to their centers, and they really have a beautiful office right in West Palm Beach. And one of the things that, it is so unique about Vital Care Infusion is that they do what they do best, right? Which is chronic disease management. So they have everybody on board, from the pharmacists and the nurses and the NPs and all the people together that they need, and this amazing agency to provide the top-notch chronic disease management by infusion.
Yeah,
So.
and Josh is going to kick me under the table for saying this, but Josh gives his cell phone number to our patients if they have questions or concerns. So we're not built for high volume of patients with lots of different needs. To that point, we're really focused on a narrow set of needs and a narrow set of patients, so we can provide that white glove service to our patients. If we started, doing hydrations and, advertising on billboards, it would turn it into a different business. And we're trying to be a lot more hands-on and in close collaboration with the providers out there that share these referrals to us, and then the patients as well. Well, and you all have pioneered this model for a long time of this white glove or concierge, or really this one-on-one service. And I think in a world where healthcare keeps, the ethos is bigger is better and centralization, and we're going to make a call center in Kentucky and that's going to handle all of our calls. You all have bucked that trend for many years, and we're trying to buck that trend too, where that shouldn't be what healthcare is. Healthcare should be one-on-one. It should be calling into our phone and speaking to a human being right away, and not getting transferred to a million different press 1, press 5 type menus. That's really what it should be. I know you guys share that philosophy. So that is why we say things like white glove and concierge, because it should feel like that for the patient, that we're really a partner in their healthcare versus we're some huge conglomerate. I'm the owner. Josh is the pharmacist. We're in the office every day. This is our team. We've got nurses that are on our, we don't have layers and layers of management between us and the patient. It's really trying to be as directly in care of the patients as possible.
And that's a plus.
Yeah.
And we are the same way.
Yeah.
So we've been around for 21 years, deficiency free. We just got resurveyed. Our reputation is absolutely stellar. And that's what you want. And over here, we all answer all of our calls. We always answer. Everyone has a company cell phone. They always answer the cell phone after 5 o'clock. And it is not push 1, push 3, push 4. I mean, we are in the world where the lack of customer service, is terrible. So everywhere I go now, when somebody gives me a good customer service, I write a review. I ask the person, what's your name? Thank you very much. I give them a tip. I say, keep up the great work. Thank you so much. I appreciate your time helping me today. People need to hear that more often, and I think that with Horizon Care Services brand, that's what we created, and that's what you created. And that's why we love to have people in our show who has that passion, that dedication, and that kind of concierge services that everyone deserves.
Agreed.
So I like the community, and you just said that you were at a walkathon or something.
Yes.
I love all that stuff. So
Yeah.
do you mind
Let her be your PR, okay?
Oh, terrific. No, it's great to be face to face with the providers and patients in a different setting than we typically see them. And it also affords us more time to share information about our services. But that is the Vital Care model broadly. Vital Care is different. There are lots of infusion companies out there that may say similar things to us, but Vital Care is actually a franchise model. So Vital Care is similar, to a Chick-fil-A in everything, in only the fact that it's a franchise. We don't sell chicken fingers, but we do have the scale of a massive organization behind us. There's 180 locations around the country. It's the number 2 infusion provider in the country. But instead of it all being controlled and owned by one corporate entity, it's owned by people like me around the country. So I get to leverage amazing technological tools, amazing resources, contracts with the manufacturers, with the insurance companies, all things that would be very difficult for me to do on my own. My job, Josh's job, our account executives, our nurses, our responsibility is being in the community, getting that service delivery right, having every patient feel like they're our only patient. That's what we need to do well. And all of the other, there's lots of other complications when it comes to running a healthcare business. Thankfully, we have this corporate umbrella that works behind the scenes to support us, but it allows us to feel like, people can run into me in Publix. And I hope a patient runs into me in Publix and says, hi. I personally call every patient after their first infusion to see how it goes. So that's the intent. We should feel like your partner in the community versus some faceless conglomerate that's 1,000 miles away. So Vital Care, it has the best of both worlds, the resources of a massive company but the service delivery of a local mom and pop, which is what we are.
Josh, can you walk me through the process as to how does it work with you, as to from intake to the process?
Yeah, absolutely. I think you alluded to earlier, there's a lot of just miscommunication and really inefficiency around this concept of coordination of care, right? You have patients who don't even know that there are medications that can be infused. They're not even really too keen on what their diagnosis is, just because they don't understand all the medical jargon. And really, unless you have a family member who is acting as your advocate, it's really hard to get through that process without feeling a little bit, disenfranchised and frustrated. Which is why, Howard and myself, we've tried to create this white glove approach where we're partnering with the doctors at that point where the patient is ready to be transitioned to us. Like, we're partnering with the hospitals, the outpatient clinics, going into their offices and seeing which patients need these meds. And we're kind of tackling that coordination of care piece, which essentially is just grabbing all the documents, right? So that can then lead into just a overview I'll give you of our process. But once a doctor's office or hospital care coordinator realizes that there's a patient who needs a particular therapy that we offer, they will send the referral packet over to us, which consists of insurance information, basic demographics, history of the actual illness that we're trying to treat, clinical notes, and then a order. I cannot dispense anything without an order from the physician, right? So then we'll take that, we will run benefit verification, we'll get that information back, we'll communicate it to the patient. They agree on kind of what the insurance will pay and what they will pay. And then from there, we essentially will prepare the medication. We will coordinate with our nursing team as to logistics. Is the patient going to come into the suite? Is the patient going to get this infused in the home, right? We'll get the patient on the schedule. We will actually have our drivers. We have a courier service company that will take the medications along with all the necessary supplies to the home of the patient, right? So that all that needs to happen then is a nurse to show up on the day that's been previously agreed upon, and then the infusion can happen. For those patients that are coming into the suite, all they have to do is just make it to our location, right? And we have the medications, the equipment, all the supplies, ready to go.
For our patients, we do offer nights and weekends. It does not have to be during normal business hours. So to that point, exactly.
That's even better.
Yes.
Are you kidding me? For people at work?
Yeah, we have for people who work, we have several teenagers who get these therapies. And so otherwise they're missing a day of school once a month, which really adds up. Here, it could be on a Saturday morning. It could be after school. We can really tailor the schedule to them. And I think the points that Josh raised, it just reemphasizes why the local element of this is so important. Again, we are giving the medication to a courier who is trained to deliver these types of medications. We are not FedExing it from 1,000 miles away. So we are handling everything with care. These are our people going into the patient's homes. We have Josh, our pharmacist, who is located down the road, available all the time. So that element, it's not just a feel good, we're members of the community, but there are elements of our service that we can provide that are different than some of these massive infusion companies that are public companies or private equity owned companies who just approach it a little bit differently.
That is great. We need your cell phone if you don't mind.
She lives in a country club. She's going to have everybody be infused, even people who don't need it. I'm kidding.
Because we're not knowledgeable about this. I didn't know anything about this.
All right, everybody. Well, thank you so much, Howard, Singer and Joshua. Thank you for coming and joining us today and share such an important information to our listeners. And if you have any questions about Vital Care Infusion, it will be down in the show notes. You are welcome to get a hold of Joshua or Howard. They will be very happy to answer any questions. If any of you out there would like to share anything in our podcast, it doesn't matter where you are in a country. We can always Zoom you in. You don't have to come to our North Palm Beach studio. Please email us at seniorcaremadesimple@gmail.com. Senior Care Made Simple podcast at gmail.com. We'll be happy to answer any questions. We'll be happy to have you on the show for you to discuss anything and everything that you may want the listeners to know. For now, thank you, everybody. Have a wonderful week, and I'll see you next time.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.